They taste and smell much like coffee.
Uh-huh.
Of course, they will never replace coffee completely, but they taste and smell significantly like coffee. And then you can also try these. All these alternatives that we have here. And see, you can obtain all these items on this list right here from health food stores, except for the first one that I just gave you a sample of.
Okay.
That one, Dandy Blend, we carry that, but you're not, you cannot.
Yeah.
As of now,
so
I
should get that one, I think.
Yes, try it.
So should I buy this one? Or is that
yours?
Just
talk to Nancy. Yeah, she will give it to you.
I'll try that because I love French roast.
Yeah, do it. Yeah, here you can take that. That's an empty box here. Take it, you can. If
Tell her
a sample there, you can take the sample. Well, they have a sample there.
Oh, let me try it. Then I'll take the sample.
Take the sample and just have the box.
All right.
Oh. Yeah, that's wonderful.
Yeah, there's one in there.
Now, people say, what if
I'll put this in there too.
Yeah. If you were to stop drinking coffee, of course, you will probably experience...
Michael's been asking me to get off coffee.
Yeah.
He wants to get off, and he's said we need to do it together to do it.
Right. So
maybe
you
this will
likely,
do it.
Sure. You will likely have withdrawal symptoms. So if, in order to avoid withdrawal symptoms, you want to do what I'm suggesting in that sheet at the bottom, see towards the bottom. I recommend that patients buy caffeine pills.
Oh.
And take, maybe one caffeine pill for each cup of coffee. For each cup of coffee that you will not be drinking. So if you drink 3 cups of coffee a day, just take 2 or 3 vitamins in place of that.
Yeah, I've been doing SAMI.
SAMI is an idea, but I think you really need the caffeine.
But I'm going to need the caffeine because I'll have a headache.
You'll have caffeine withdrawal headache.
Yeah.
So black tea and green tea is fine. You can drink lots of those.
I love those. I love green tea.
Drink lots of them. But I'm not sure if they'll sufficiently replace the amount of caffeine you get from coffee. So I think buying caffeine pills would be a smart idea.
I'll do that. I'll get that. I'll get started right away.
Yeah. So
okay, I will do this. I can do this. I mean,
you can do it. It's easy.
I can do whatever I set my mind to. I can do it.
That's right. And so
I will read this at home.
Yeah, do it.
I don't want to take the time here.
No, that would be done. And I'll give you, because it's been so long since we saw each other, I'm going to give you a whole packet of information that I give all my new patients.
All right, I'll take it.
Here.
Thank you.
You're welcome. And just remember, we talked, besides the your homeopathic remedy, Carol, besides that, detoxification is what I believe you desperately need.
Okay, so how do we start that?
The most important, or one of the most effective ways of doing detox of your internal organs is rubbing castor oil on your abdominal area.
I used to do that all the time.
Yeah, and you might, if I were you, I'd rub some on my thyroid too.
Oh, that's a good idea.
Rub some on your thyroid, start from the top of the breast, rub it on the breast, go all the way down to the groin area, cover the sides, and it just needs to be in contact with with your skin for minimum 30 minutes a day. So you just rub it on, one thin layer, 45 minutes a day would be great.
Yeah, I could sleep with a night flannel.
You can. Or just in the evening, some people don't want to go to sleep with oil on.
Might feel weird.
Or you might get oil in your bed.
Oh, I don't want to do that. My sheets are expensive.
Exactly. So I would say in the evenings it's a good time for people to just rub that on, maybe have a t-shirt on, especially with summer coming now.
Oh, yeah.
You rub it on and just hang out in the evenings, and then after 45 minutes you take the t-shirt off.
Should I put it on my hands too?
I would highly recommend you put it
just
everywhere.
Bathe in it.
Yes.
I'll bathe in it.
Rub it all over your hands.
Yeah.
And once you have that t-shirt on, and you just rub some oil, castor on your hands, you can put it on your feet. It'll help with arthritis on your digestive.
I'll do that.
On your, if you apply it over the abdomen, it helps with cleansing of your internal organs, your intestines and liver. If you put it on the breast, it helps with lymphatic flow in the breast. When you put it on your thyroid, that blood pooling in your thyroid, it could very well help with that.
That would be
so
good.
I really would highly recommend that. Now, as other things that help detoxify the body would be, remember those drops, those UNDA drops? I would recommend those drops. Okay. Remember these drops?
Yeah, I had them before.
You can take that one for your liver, one for your kidneys. And drink these teas, those liver teas sitting there. You see those teas right there? It says the liver right here, these two.
Yeah, liver function.
Right, they promote healthy liver function.
Okay.
All 3 of them, and you can alternate among them.
Oh, traditional medicines, that's in the health food store.
Right.
Yeah.
And we carry it too. You can get it from anywhere you like. But
which one tastes good?
It depends on the person. Honestly, I have a hard time picking. They're all good. Some people might love one and hate the other, or vice versa. So it really depends on you.
Yeah.
I would recommend you try them all.
I've got burdock root, dandelion root.
So try to get used to these teas.
I will.
And drink them regularly. Not only will it help with your constipation, it also helps with your the entire digestive imbalance that you have.
How many cups of tea should I have a day?
I wouldn't have more than one.
Not more than one?
I wouldn't have more than one. You can have the green tea and black tea more, but then the liver ones, because it's highly medicinal, you might get sick if you drink more than one.
Yeah, I don't want to do that.
No.
Because I got to drive.
Yeah, and as far as your vomiting, for now, I would not stop them with omeprazole.
Stay on it for a bit longer. Yeah, I figured I'd have to.
You need a lot of detox before you can go off of that.
So I'm going to get this tea.
I'll write it down. It's all written. You don't have to remember it.
Oh, okay. Thank you.
You're welcome.
So I have that. And then what else? The drops.
The drops. Of course,
do I need any probiotics or anything?
Just for this visit, no. For right now, I don't think it's urgent that you do it.
Yeah. Anything else?
Yeah, let me see. You drink plenty of water?
I drink a lot of water. I love water. It's my favorite beverage.
Good.
Other than coffee.
I like hearing that.
Yeah. I make tea sometimes and take in there.
Okay, so
green tea is what I like. Normally I just drink green tea.
Good. How are you feeling? Are you feeling any new feelings since you took the remedy?
I just feel totally relaxed. More relaxed. Yeah.
Good. So,
I don't feel the fatigue I was feeling.
You feel more energized?
Yes, I'm not feeling the fatigue. I just realized that's left.
Good.
When I first walked in, I was so sleepy. I thought, how am I going to drive home? I feel great.
Awesome.
Yeah, I should clean that spare room. I got the energy. Well, my sister's coming this weekend, so that'll be fun.
Right, that's awesome. Awesome.
Yeah, I feel good.
Good, so glad to hear it.
I'm so glad to be back here.
It's an honor.
It's an honor for me.
Yes.
I need some names for a doctor in Colorado.
Oh, Colorado. Okay, I'll
she
give you
really is desperate. And then I have my sister called me. She says, "You're going to your naturopath? Please ask him for a doctor for my for the nurse at the hospital." She said she's had it with doctors, and she wants a naturopath doctor in Salem area.
Oh, Salem.
Portland, Salem.
Salem, I don't know anyone, but Portland I do.
Okay. She'll take whatever she gets.
Okay, here.
So I need that so I can get this out to them. Put them on separate pieces of paper.
Oh, separate?
Yeah. So that. Yeah. Because I'll put one's going in the mail and I'll say this is directly from my doctor.
No. In his office.
You have to have more education than a regular doctor.
Well,
you do.
As far as the number of years we go to school, they have long residency programs. So I can't say we have more education, but we take I would say a very diverse background. I mean, we cover all the conventional medical classes that conventional medical students do in medical school.
Yeah.
We cover all those, with less emphasis on pharmacology, study of drugs.
Yeah.
But then instead we take all these natural classes like, pharmacognosy, we take plant medicine, homeopathics, hydrotherapy, philosophy of natural medicine. So we definitely have more exposure in our schooling.
Yeah.
But then they have the longer residency.
Okay.
Yeah. It's just different.
So chiropractor was saying how much they have too, and it's a lot. Thank you.
See if you can read that.
Dr. Dick Tham, T-H-A-M.
Tom, yeah.
Tom, T-H-O-M. O-M,
yeah.
Okay. And what's that next words? What's this?
Or anyone else in his office.
Oh, or anyone else in his office.
Because he might be booked.
Okay.
Yeah.
What's his phone number?
I don't have it, but you can look him up. He's all over.
Okay, and he's a naturopath.
And he's very, very...
And Dr. Eric Doringer?
Doringer. He's in he used to be in Boulder.
Okay.
Yeah. Now, Dr. Dick Tom in Portland, he's very famous, so he's usually booked for God knows how long.
Oh, so, that's wonderful.
Yeah.
So I'll tell my sister.
I have high regards for him. Yeah.
Yeah. Wonderful.
Yeah. And Dr. Doringer is a friend of mine.
magic box.
Doringer is a younger doctor like you, and he's a friend of mine, little classmate.
Oh, yeah.
Lovely guy. He's awesome.
Oh, thank you for recommending.
Oh, you're welcome.
I think they'll be very happy.
You're welcome. Here's your treatment plan.
Okay.
So I gave you that homeopathic remedy, which the students are not supposed to hear, right? the first one.
Okay.
Right, and then those drops, the UNDAs that I highlighted. The first one is for liver cleansing. The second one is for kidney cleansing.
Okay.
And then castor oil, we talked about it. And the liver,
Yes.
those teas for liver cleansing, we also talked about that. And then last but not least, that supplement called oxy powder.
Yeah,
That's a highly potent magnesium supplement.
I take magnesium at night.
That's
but
good.
that makes you relax. It's the best thing, magnesium.
This will make you relax, all right, but it'll definitely makes you go. It'll make you go.
Oh yeah.
Yeah, it's very powerful, and in the minority of patients, it can cause cramping because it will cause peristalsis. See, it'll in some patients it can cause peristalsis.
Okay.
I mean, it's kind of significant
then.
enough that it can cause cramping.
Wow.
Yeah. So
must be very powerful.
It's pretty powerful. So with that, if you take that daily, you can take one pill as needed. Some people need one a day, or two, or up to 3 or 4 even. But if you take that and drop this castor oil in your abdomen, that should take care of the constipation.
I think it'll take care of it totally.
Yeah, and that's very critical because remember, your skin and your joints are having issues due to the main organs of detoxification being plugged up. So what we call your secondary organs of detox, which are your skin and joints, are blocked.
Yeah.
I mean, the disease, they're not blocked. They're manifesting the imbalance in your system because the primary organs of cleansing are blocked. And the primary organs of cleansing are liver, kidneys, intestines.
Yeah.
So
cleanse.
And
now, how about the weight loss?
the weight loss, as you get healthier, you will lose the weight. That's like a sure thing. But if you want to lose weight faster, I would
fast track me.
Like fast track. If you want to fast track, I would say let's do this for a few weeks, and maybe at your next visit in 3-4 weeks from now, maybe 4 weeks from now, there is a 21-day cleanse/fast program we have that I highly recommend.
I remember a long time ago you had said you'd help people lose weight.
Yeah.
And you'd had some pretty good success stories on it.
You can have this if you like. This tells you about that. This is a 3-week purification program.
Okay.
And it's wonderful.
Okay, and it tells you what to eat and what to write.
Exactly.
Oh, good.
You basically follow that program for 21 days, and you will not only feel much cleaner, it'll cleanse all your entire body.
Wonderful to feel.
And it'll cause some good weight loss too.
Yeah.
So just remember, the next few weeks you may especially the first week or two from today, your body might miss coffee, so it may be a little rocky. This good feeling you have right now ideally would last for weeks, but because you're going to have caffeine withdrawal, it'll just rock the boat. The withdrawal from caffeine will rock the boat. Will rock your experience right now. This good experience may not last for 3 weeks. And it would if you weren't.
I hope it does.
Well, it would if you weren't not a coffee drinker.
But
because you are going off of coffee for the next week or two, you may just. If you take enough caffeine, hopefully you won't have any problems.
Yeah.
So you gotta have.
So I'll get that Vibrant.
Yeah.
Yep. Okay, I'll do that.
They come under different brand names, so just look for some good, high potency caffeine supplement, pill.
And so I show Nancy this, and she'll get all this for me.
And just remember, if you, let's say before your next visit, which hopefully will be in 1 month, before your next visit, if you start feeling like, you know what, I felt, if you tell yourself I was feeling great after the homeopathic remedy for 2 weeks, and then I started to really crash, energy-wise, mood-wise, the throat's, the sensation of restriction in your throat, if it comes back, the joint pain, it starts to get worse again.
Yeah, because I don't feel any restriction now.
Right.
It's strange.
Right. Now, if that starts to come back, let's say in a week or two before your visit, which is in a month, then just call and let me know. We'll talk.
Okay.
Sounds good?
Yeah.
All right.
Thank you.
You're welcome, and thank you so much. I'm going to stop this.
Okay.
Thank you.
Goodbye.
Goodbye.